Good morning and welcome back to Instagram Live with Intimate Rose. I am Dr. Amanda and I will be joined by the always informative and uniquely funny and entertaining Andrea Martin. She's a nurse practitioner specializing in and certified in menopause treatment. Today we are going to be dispelling some myths about menopause, hormone therapy, and we are going to be talking specifically about symptoms of reflux. So she's going to be popping in here today, so be sure to type any. There we are. And then we'll be sharing a code for 10% off that is good for the next week on intimaterose.com. And you have to listen all the way through to get the code. Hi, Andrea.
Hi, hello.
Don't let me log off without giving the code, okay?
Okay, I'll try.
Thank you so much for coming back. Today, we're going to dispel some myths about hormone therapy or hormone replacement therapy, also known as menopause therapy. And then we're going to talk specifically about the symptom of reflux.
Let's do it.
All right, so let's begin at the
Mhm.
top. Andrea, is hormone replacement therapy safe?
Yes, absolutely. We can never say one medication is safe for absolutely everybody, but when you look at the data, the majority of people actually are very good candidates for hormone therapy. It's something that's gotten a really bad rap, unfortunately, but can provide a lot of great benefits.
Fantastic. And additionally, a lot of people want to know, is it natural? Because when they think of natural, sometimes they think of herbs and supplements and things. One of the things that I've heard you say is we are just simply giving your body back a hormone that was naturally occurring, but now it's occurring in lower states.
Yeah.
So is that the case?
Yeah, I don't really think it gets any more natural than that. Taking something that you were already making for, I don't know, 40, 50 years and just giving yourself a little bit of it back so that you feel good. I don't think it gets more natural than that.
That's wonderful. And how does hormone replacement therapy work?
So, in general, there's three hormones we can play around with. The big guy or the big one is estrogen. That's like the main one that really takes care of a lot of the more well-known symptoms like hot flashes, night sweats. Can help with brain fog. Some people it helps with joint pain, things like that, vaginal dryness. So that is administered in various ways. You can take it by pill. You can take it by a patch, a gel, a cream, a vaginal ring. And that's going to do a good job just kind of making you feel better. If you have a uterus, um, which most of us do, but sometimes they get kicked out before you head into menopause and need hormone therapy. You do have to take some type of progesterone or progestin to protect the uterine lining from the like proliferatory effects of estrogen. So basically that just means estrogen's nice. It makes things grow and be happy and healthy. We just don't want our uterine lining to grow after menopause, and progesterone will stop that completely. It also helps us sleep, helps with mood, and helps with anxiety. And then third hormone, which is less commonly prescribed but becoming more popular, is testosterone, and we use that a lot in women, especially to help with sex drive and libido.
Absolutely. So they work together and they keep the estrogen coloring inside the lines.
Exactly. I like that.
Wonderful. So some people that are on hormone replacement therapy experience GERD or reflux type symptoms. Can you talk about why that happens?
Yes. So GERD is gastroesophageal reflux disease. Um, if you're Italian, it's known as agita, medical term. Do they say that in Portuguese? Do they have a term?
I'm going to have to look it up. They are both Latin derivatives, both Italian and
Yes.
Portuguese. So I
Mhm.
imagine it's something pretty similar. So now I'm going to look that up.
Yeah. Italians love to talk about agita. Everything's agita. So it's heartburn basically. And some people that, can present a little bit differently. Some people will then have like trouble swallowing or pain with swallowing, chest pain. You can even see like a chronic cough, or sometimes people's voices will get a little hoarse. Um, so basically, when we eat and swallow foods and liquids, on a good day, it's supposed to go down your esophagus. Sometimes we choke, it goes down the other tube. But on a normal day, it goes down your esophagus. So it comes down the esophagus and it reaches this little doorman there called the lower esophageal sphincter. And its job is to relax, let the food go down. And then when there's no more food or liquids passing through, it's supposed to tighten back up so that whatever's in the stomach doesn't then come back into the esophagus. So with GERD, that little sphincter there um, kind of relaxes at the wrong time. So then you can have a reflux of stomach content, stomach acid, food, things like that. And then that's really irritating to the lining of the esophagus. So where this comes into play with menopausal hormone therapy is that some people will actually experience worsening of those symptoms. So how does this happen? There's a couple different mechanisms. Estrogen actually can increase your stomach acid production. And progesterone, we always think of progesterone as like very relaxed and nice and happy. It also relaxes that sphincter that we want to keep shut at the correct time. But if it gets a little too relaxing, we have that reflux that happens. Um, there's also a little bit of evidence that estrogen is involved in nitric oxide. So nitric oxide's kind of like, again, one of nature's muscle relaxers. So that's another mechanism where that lower esophageal sphincter can open when we don't want it to. This is where so I was doing some research and I found this interesting because in my experience with my patients, and even when I was asking my coworkers and friends who do this all the time, for us, we experience more often that it's the progesterone that causes those symptoms more so than estrogen. And when I was looking at a few studies, it said that estrogen actually produced higher rates of GERD compared to progesterone alone or progesterone plus estrogen. So I was very, I don't know, shocked by that because it seems to be, at least in my experience, that progesterone tends to have this. But like I said, both can cause it. There's, and then this is where I think it gets really confusing because why not have things get very confusing when we're talking in menopause? Um, Menopause itself is an independent factor for GERD. So you've got that going on. So maybe it was going to develop anyway. There's some studies that show that lower levels of hormones when you're going into menopause put you at an increased risk for GERD. But then also when you look at the other side of the spectrum with women in pregnancy, when their estrogen and progesterone is super high, they're also at increased risk for GERD. And it's not just because there's a big old baby sitting in there with that mass effect. So it seems like maybe there's some kind of little like happy medium upside down bell curve area of happiness where it's not too much, not too little bit, and maybe that's kind of where people feel the best.
That's really interesting too, because I also think about some age-related changes that were going to be in effect anyways, and the way that diet might change at certain
Hmm.
phases of life, and the role that nutrition plays as well. So as you mentioned, there could be a lot of drivers of the why.
Yeah, absolutely. And like you've got other things that are going to put you more at risk. Like weight gain happens, and we all know when it's so much harder to lose weight in menopause and perimenopause. If you're more sedentary, which can also happen as you get older, even more likely to take medications at that time that can cause GERD, like NSAIDs, calcium channel blockers, antidepressants, things like that. So again, it's not always the hormone therapy, but probably is if you just started it and then those symptoms started. And
So what is, oh, go ahead.
no, I was gonna say the one thing that I was trying to look for that I don't think really exists, that we don't have good data on different formulations. Like, oh, do we see less GERD if you take estrogen, topically instead of by mouth, or, synthetic versus natural, bioidentical, all that stuff, but it doesn't exist yet. But I think that would be interesting to learn more about.
Absolutely. And we're going to take a deeper dive on those three different methods of hormone therapy in 2 weeks when we have our next date.
Ooh,
So we'll be talking about the different delivery methods of patch versus gel versus oral hormone therapy, and what people can expect. So everyone, mark your calendars for April 3rd. Um,
yes.
what are some things that people who are experiencing reflux can do to soothe those symptoms?
Yeah. So some of this stuff is not independent to hormone therapy. Some of it's just the regular stuff you do for GERD. So like not eating a giant meal before you go to bed. I always say it's with bladders and with GERD, it's like kind of take away all the fun food or eat less of it, like avoiding spicy stuff, greasy food, alcohol, carbonation. Smoking makes it worse. With patients that the progesterone specifically seems to be the driver, sometimes it doesn't work for everyone, but sometimes if they actually insert the pills vaginally instead of taking it by mouth, that decreases symptoms. Um, we also can play around a little bit with the progesterone and get it compounded in like extended release capsules. So you kind of, it gets released into your body slowly over the course of the night, and that seems to help with some people. Um, trying experimenting with different formulations, maybe lowering the dose, and then, stuff like Pepsid and all those kinds of normal GERD things. So we got some different workarounds that we can use.
From a digestive standpoint, too, Andrea, you and I have shared many meals together. You know how slowly I eat and how long it takes me to finish a meal. And one of the reasons why is because I chew each of my bites like 30 times because I have autoimmune disease and other digestive issues. So, from a physical therapy standpoint, managing a wide different variety of bowel and stomach type issues, one of the things that I remind my patients is that you do need to chew each of your bites 25 to 30 times. It allows the saliva to really break the food down, and that allows our body to process. I think that we live in a society where people are slamming down breakfast and lunch, possibly even at their desk. They are just getting it down very quickly. They're not taking time to go slowly and chew and savor. And both from like a complete vagal system approach and also your body's ability to process that is really helpful, because if those bites are going down in massive chunks, that is going to upset the lining of the esophagus. It's going to upset the doorman, the flap, and
Mhm.
it's harder for your stomach to digest. So chewing seems so basic, but really and truly, it's not. You don't have to sit there and count, but just make sure that the food is really soft before you swallow it.
Yeah, it actually takes a lot of like you have to pay attention to it. I am bad sometimes, like it just multitasking, shoveling food in my mouth and not even paying attention. My partner's away and he ended up FaceTiming me last night when I was like just about to eat my dinner, but I was like, I'm gonna get back to you because I want to focus on this and actually enjoy my food and chew it and eat it because I know how this will go. The conversation will be over, and I'm like, I don't even remember that I just ate. So
Take
sometimes we got to be a little mindful about it.
That's right.
Hmm. Yes, we love food.
And yeah, yes. Are there over-the-counter things that people could or should take, or maybe things they should avoid that might be contraindicated or not get along well with the hormone therapy?
That's a good question. I can't think of anything specifically that might, interact with it and make things worse. I'm sure it exists, but over the counter stuff again, like famotidine, Pepsid, all that kind of stuff is over the counter. You can try even like doing Tums, things like that. You don't need a prescription for that. Um, but always nice in my mind if you can reduce symptoms with like lifestyle changes, which I know are less exciting and fun and more work, but I always think that's nice if you can kind of at your baseline reduce the symptoms instead of having to then add on something else to manage it. But you got to do what you got to do.
Absolutely. And I think too, again, from that vagal nerve digestive standpoint, really analyzing the role of stress, because I think one of the things that we notice in a lifetime flow perimenopause and menopause is happening at what is often a peak phase of career, familial, and personal busyness and stress
Mm-hmm.
in cases. I was realizing too, it's a really common age and phase to get divorced or to have
Yep.
your parents passing away or to
Yes.
experience just these massive storms that come up in life. And I was realizing, several of my girlfriends are getting scopes and endoscopies and colonoscopies, and we're in our 40s, and I'm looking around looking at how stressed out all of us
Yeah,
are.
absolutely.
So these also play a massive role. And so we want to be quick to point the finger at the thing, the hormone
Mm-hmm.
therapy or this or that or the other. But sometimes we must go into the cave and really
Exactly.
analyze
We
what's
gotta do
going
the
on in
thing.
our life. Yes.
Yeah. I see a lot of patients in that age range too. In addition to all the like you work and you have kids and maybe now some of them are going to college and this and that, is the no, my parents are aging and they're getting sicker and it's role reversal and I got to figure out how to take care of them. And that to me, from what I've observed, is one of the most stressful things that a person can experience and is really hard to watch and go through. So like you said, it's a tough time in life that I feel like doesn't always get the acknowledgement that it deserves. Like even when you go through puberty, I feel like there's all this talk about that, like big changes in mood and this and that, and here's books about it. And then menopause and perimenopause is just like, we're not gonna tell you anything. It'll be fine.
And the grace is not necessarily there. I think we give a lot of grace to our teenagers and then we just say,
Yeah.
oh, they are going through the hormone
Hmm.
swings. But then when it's in those hormone swings in a grown adult, it's she's nuts
Yeah,
or
she's
she's
crazy.
acting out. Yeah.
Hmm. Yeah, yeah, something's wrong with her, and just like, why can't she get it together? Well, I have a feeling if you felt how she felt, you might be a little off kilter at times, not be able to keep it together at every moment. So, yeah.
That's exactly right. Our tolerance gets a little less.
Hmm. And it's
Well,
okay.
that's exactly right. We get educated, we learn what's available to us, we learn that hormone therapy is generally speaking safe for most people, and
Hmm.
we learn how to mitigate some of the things that might come up with it, as you've talked about.
Absolutely. We like to take a little individualized approach. We give general information to everyone, but for each person, certain things are going to work better. And once you find your little sweet spot, it can just make life a whole lot easier.
Oh, I love that.
Hey.
Is there anything
Yeah.
else that you would like people to know about hormone therapy and reflux or GERD type symptoms?
Mm, I think I said all the things, but definitely if it's something that you experience, bring it up. I have a patient now who like loves her progesterone. She was like, I finally got the best sleep of my life. And she's like, and my GERD is back. And I know, we're both like, come on. So we're both working together. We're going through this process now. Okay, let's try this. Let's try this. So, we'll find what works for her. And it is a little bit of a journey sometimes, but um, I feel ya. It's tough to see something work so well and then be like, shoot, I got this side effect. But we can deal with it.
That's exactly right. We have solutions.
We have some.
Well, for those that are interested in more information about hormone replacement therapy in the perimenopause and menopause space, they can see your account. And then we have videos here on ours and then also on our website, as we are offering those services via telehealth now,
Yay.
which we are very excited about and which we are so grateful to all of your leadership and paving the way for us.
It's important. I just see, you see it a lot on social media, and then even with interacting with patients, I see in person, hearing about like, I had to go to this place and then this place and then this place, and like, finally I'm here, I'm getting the hormone therapy I'm looking for. And I just think the more opportunity we can have for people to be able to access it, the better. Just, it shouldn't be as hard as it currently is.
Absolutely. We're here and we're listening, and we're going to help people find the solution that works best for the unique person that they are.
Yes. Now give them a code.
That's right. Okay,
Give
the code for 10% off for the next week is Reflux. Reflux. It's Reflux. And so that is available on our website at intimaterose.com on all of our tools. And we're always here to answer questions. You can put them in the comment section on this video, which will be saved. And then Andrea, we will be back here, same bat time, same bat place in 2 weeks. April 3rd, we'll be discussing, was it breast tenderness or was it a different? Darn it.
I don't
Okay,
know.
we'll be discussing a hormone replacement therapy topic, and we will also be dispelling more myths. It will either be breast tenderness or it will be dissemination of the types. But this will be our
I
ongoing
heard your
series.
voice slowing down, and I was like, oh, she's gonna ask me, and I don't remember either.
So, crash and burn
Let's
live
talk
on
about
Instagram.
something.
We'll be here talking about being Italian and Portuguese. Thank you so much for joining us. And thank you, Andrea, for your time and expertise. We appreciate you so much.
Thank you. We love you too, and have a lovely day.
Bye.